Hello, I'm welcome to our Doc Plexus viewers. I'm S.B Gogia from New Delhi. I am working in the very common but not very well known disease of lymphedema. And today with me, I have a panel of international experts who will be sharing their views on this problem and hopefully try to increase the sadly deficient knowledge base of lymphedema in this country and even across the world. On my left first is William Reputed, who is a chairperson of international organization called Lymphatic Education Research Network. Next to him is Stanley from Stanford University, who is a physician who's done a lot of work on lymphedema. And then next to him is Andrzej from Poland, who is also the president of International Society of Lymphology. We are all gathered today in Mumbai for the VAICON meeting, and we are fortunate to have Dr. Plexus ask us a few questions. And now I just want to hand over the first session to Stanley to tell us about the problem and what can be done about it, and is there hope or not?
Thanks so much. Yeah. So that's an interesting question. It's actually quite a paradox. Lymphedema is an extraordinarily common medical condition in the United States. We enumerate perhaps 5 or even 10 million individuals who have this. In the world, estimates which are difficult to ascertain with certainty, but we think probably 250 million people in the world. It is a disease that causes significant morbidity. These patients lose their ability to do their jobs. They can't function in their homes. There have been very elegant quantitative studies to show that there are psychological impairments that are profound, including anxiety and depression and social isolation. But most importantly, at least in the United States, we find that patients are very troubled by the fact that they are not taken seriously by the medical community. Physicians are not prepared to deal with their problems. They don't have answers. They often don't even understand the scope of the problem, let alone what can be done to help it. I did a study about now, I think 15 years ago, where we polled the heads of departments in North America from the medical schools to determine exactly how much time is spent educating physicians and physicians to be on the lymphatic system, not just lymphedema, but the entire system as it serves human health and biology. And we found that on average, these doctors-to-be spend less than 30 minutes in their 4-year medical education learning about this. So it's little question that these doctors are not prepared once they go into practice to deal with the patients. But it is paradoxical because there is indeed quite a lot that can be done. And given how many patients suffer from this and what the impact of the disease is, it's very important that we all come up to date and understand that there are treatments for today and even more exciting treatments for tomorrow.
Thank you, Stan. Professor Andrzej, what do you think are the various treatment possibilities, and can you expand on the hope that has been told about by Stan?
Starting from the basic conservative therapy. So the lymphedema, should be recognized early. The earlier we recognize the problem, the easiest is the treatment, and that's the first thing. The basic therapy is conservative, so it is complex decongestive therapy, which with its main component, which is compression therapy, and compression therapy with the inelastic or low elastic bandages was developed, actually is known from 19th century, so it's not modern technique, but it's working, it's very effective. There are some options in severe lymphedema patients. There are options for surgery, and actually in the recent years microsurgery is developing again, and it's really with lymph node transplant and lymphaticovenous anastomosis. It is starting new era, which is very promising. In advanced cases of lymphedema, also liposuction is very effective to reduce the bulk of tissue, but not to restore the lymphatic flow. And finally, the pharmacotherapy, which now it's really not very effective. It's effective in early stages, but the recent research done by Stan and his team showed that we may have hope for new medicines that can not only stop the disease, but reverse the pathological process, which is very promising, and we'll await for further results.
Thank you, Professor Andrzej. Before I come to the Indian aspect for it, I would now like to ask William Reputed to introduce himself fully and tell the role that he's playing and the actual problem of how, from the social perspective, we need to tackle this. It is a big social problem. William.
Yes, William Reputed. I'm the president and CEO of the Lymphatic Education Research Network, and our mission is to fight lymphatic diseases such as lymphedema through education, research, and advocacy. Certainly we do a great deal of effort to increase research and get groups like the National Institutes of Health to increase it, because we'd like to find a cure and certainly further treatments. But one of the things we deal with on a daily basis at this point is the patient response to physicians and very often general practitioners who either don't recognize the disease, and as a result, the disease progresses for many years before they get a proper diagnosis. And now it's been very difficult to turn back the clock at that point. The other thing that seems to happen, even with those doctors who should know better, and in the United States, certainly that would be oncologists, since a very high proportion of those that get cancer and survive cancer end up with lymphedema. So we estimate there could be approximately 30% of women, for instance, who have had breast cancer who end up getting lymphedema. And yet, very often what I hear from these women is we were never told about the possibility of lymphedema beforehand, so we could prepare for it and mitigate the impact of it. After we did get it, very often we were told by our oncologist, I saved your life, this won't kill you, don't complain, find a therapist. And we hear that statement over and over again, which only exacerbates the problem for the patient, who now feels that they have a disease that is completely disrupting their life, but they have no right to even complain about it. Certainly a big part of what LE&RN is about is, given the fact that there are up to 250 million people in the world with this disease, 10 million in the United States, estimated perhaps 20 to 40 million here in India. If we can pull all those people together to complain enough, show their anger, and demand that they are not willing to put up with this anymore, great change can happen with that kind of critical mass of people demanding change. And so we have created World Lymphedema Day, which is on March 6th, that pulls the world together. And we have chapters all around the world as well that help consolidate that patient a message. Of course, we work with people like Dr. Roxon very closely, who is a co-founder of our organization, because ultimately it's the cure that we are looking for, but that means money. Research means money, and the way you get money is you have to have a lobbying force that says that this disease rises to the occasion of needing to be a top priority. And right now, I think part of the problem is because many physicians don't know how to treat it. Rather than admit it's something serious they can't do something about, they try and tell the patient it's really not that serious, and so it's not so much my problem as failing from being a physician that I can't solve this for you.
Thank you, Will. What I would just like to, before I summarize in the end, I would like to add a few points from the Indian perspective which will need to be told. One of the things that, the perception that is given to any lymphedema, they think is filaria, which is something we really need to change. It occurs after lots of conditions. We do have a specific Indian and tropical condition known as podocorneosis, but that is not so common, as is the commonality. Now with cancer treatment coming up, it has become very, very common in India. And along with that, the main thing that we are finding in our thing is that all of them, whether the initial causes, filaria, cancer, podocorneosis, recurrent infections are a very constant accompaniment of this, and that needs to be taken care of. What I do in my practice is to give most of these patients penicillin, which is long-term penicillin, which you give for this thing. Filaria treatment at this stage does not matter. You do not need to give them anti-filaria endlessly. You do need to give them if it's from a filaria endemic zone, definitely, but once or twice is enough. Anyway, the government is doing the anti-filaria program, in which it is giving annual payment, delivery of albendazole along with DEC, as well as now ivermectin has been added. that has brought down the incidence of filariasis, but not to that extent the incidence of lymphedema, because that is an effect of childhood disease. If we treat it properly, and we have to remember that lymphedema, by the time it presents to you, is a chronic disease. So lifelong care is required through leg washing, antibiotics, and of course through CDT has been mentioned already. And CDT needs to be done through therapists, introduced through therapists. But finally, the therapist, what the role is to tell the patient how to take care at home, and there are a variety of solutions available. They can continue managing themselves at home and be comfortable, be working, and be a part of day-to-day living. Thank you.